Biden's office released a statement about the diagnosis just a short time ago. Here's what it said. Last week, President Joe Biden was seen for a new finding of a prostate nodule after experiencing increasing urinary symptoms. On Friday, he was diagnosed with prostate cancer, characterized by a Gleason score of 9 with metastasis to the bone. While this represents a more aggressive form of the disease, the cancer appears to be hormone sensitive, which allows for effective management. The president and his family are reviewing treatment options with his physicians. Prostate cancers are given a Gleason score that measures on a scale of 1 to 10 how the cancerous cells look compared with normal cells. Biden's office said his score was 9, suggesting his cancer is among the most aggressive. The 82-year-old left office in January as the oldest president in history. In February of 2023, Biden had a skin lesion removed from his chest. That was a basal cell carcinoma, a common form of skin cancer. And in November 2021, he had a polyp removed from his colon that was benign. During his administration, Biden made his Cancer Moonshot initiative a priority with the goal of cutting the cancer death rate in half. The initiative was personal, as his son, Beau, died from brain cancer in 2015. All right, let's bring in a medical expert now to understand more about the former president's prostate cancer diagnosis. Joining us now, Dr. Manish Vira, Assistant Chief of Urology at Northwell Health Cancer Institute, with a specific focus on prostate cancer. Perfect person to walk us through this as people who don't have medical backgrounds. So, doctor, when you hear the details of the former president's diagnosis, what's the prognosis in your mind?
Well, unlike a lot of other cancers where when you hear stage 4 cancer, you think I have only weeks or months to live. With prostate cancer, the treatments that we have available can keep patients around for a very long time. The treatments are very effective at controlling the disease, reducing symptoms, and helping patients live for many years in some cases.
That is very encouraging. How does the president's age factor into this when he's considering different treatment options?
Well, certainly all of the treatments that we have, although they are very effective, they can have side effects. And certainly a patient's age, their medical history, how they are functioning, all of those things will make an important difference in terms of how they can tolerate the treatments. But President Biden should definitely do very well.
So the statement also offers some hope in the sense that the cancer is what they're calling hormone sensitive. Can you walk us through that? What about the hormone-related treatment options? How does that work?
Sure. So prostate cancer in general is fed by testosterone. Not that testosterone causes the cancer, but it uses your body's testosterone to drive its growth. And so one of the most effective treatments that we have for prostate cancer is suppressing the body's testosterone production such that once the testosterone levels go down, the cancer cells will shrink and the tumors will shrink.
That makes a lot of sense. All right, Dr. Manish Vira, thank you so much for your time and for the insight tonight.
Thank you for having me.
Thanks. And President Trump has released a statement just a few moments ago on Biden's diagnosis. He posted on Truth Social, quote, "Melania and I are saddened to hear about Joe Biden's recent medical diagnosis. We extend our warmest and best wishes to Jill and the family, and we wish Joe a fast and successful recovery." We'll have continuing coverage of this breaking story on air and online at cbsnewyork.com. And you can look for much more tonight on CBS News New York at 11.